Hi, my name is Shelby and I'm a graduate of PRS's LINC program. In the fall of 2018, I left home for the first time to attend Radford University. A couple months later, I got physically sick. Multiple doctors and clinics in the area tested me for physical conditions like the flu and mono. The test returned negative even though I was getting sicker and sicker. The week before Thanksgiving, I ended up leaving Radford and never went back. When I got home, I went to my primary care doctor and got a lung x-ray. They diagnosed me with severe pneumonia and prescribed medication that made me feel physically better in a few days. However, my mind was racing because I felt I had so much to catch up on and I couldn't sleep. On Black Friday, my dad gave me his credit card to buy new clothes. I went to the mall and spent roughly $2,000 until the card was cut off by the bank suspecting fraud. Since I wasn't sleeping, I began to slip into a state of what I now know to be psychosis. One of my friends, who has a sister with bipolar disorder, recognized my symptoms. She spoke privately to my father and told him that I needed help and I needed it now. The next morning, my dad took me to the hospital. I knew something was wrong and I needed help. I got admitted to the psych ward for 2 weeks. The first week, I don't remember anything. I was on so much medication. Not knowing what happened for a whole week is the scariest thing I've ever been through. My social worker in the hospital reached out to LINC and sent a counselor to meet with me. My LINC counselor worked with both the hospital and my parents to manage my case. I felt like I had a positive professional advocate on my side who has had experience dealing with situations similar to mine. I was discharged a couple weeks later and I began treatment with the LINC team weekly. LINC stands out because I was able to meet with my counselor more than in traditional therapy. My counselor challenged my thoughts and educated me on my new diagnosis. Education is the most important part because if I, someone with bipolar disorder, doesn't understand, then how will others? My LINC counselor guided me to set short and long-term goals that I felt were realistic to accomplish. She helped me realize my strengths, weaknesses, and needs and allowed me to become my own advocate. She and the team always met me right where I was mentally. I felt like I could be open and have a real conversation about my feelings and tell her if I was struggling with any symptoms. I had to withdraw from school but wanted to go back to work as soon as possible. My LINC counselor encouraged me to reach out to my old restaurant job. I began working at the restaurant and started school again at a local community college. I was doing well for over a year and learned skills that helped me cope with my disorder and be a productive member of society. I ended up back at the hospital in fall of 2020, this time for almost a month. It was during COVID, so we were allowed no visitors and it was hard not to see my family. When I got out, I realized I was too behind on school and had to drop out again. This time, things were different. I had coping mechanisms and had been through all of this before. I was able to pick myself back up, get a new job, and resume school again the following semester. Now in September of 2021, I have been at my job for almost a year and I'm finishing up my associate's degree at the local community college. There have been bumps in the road, but everything happens for a reason and I am happy and grateful to be a LINC graduate. The coping skills and education I have gained is worth more than money can buy.